It's a beautiful day for Teaching Tuesday. Today I want to tell you about how we're back operating. We've been operating for about a week and a half now. We've been seeing virtual consults the whole time. Schedule's already full for May going through June, but things are a little different. And I'll tell you why things are a little different in the post-COVID environment. Trying to protect patients, and so I'm in the OR now. And just like in the office, things have been a little different. For instance, here's a waiting room, and I'll show you something. There's nobody in it. And that's just like in our office too, on the other side. What we have to do now is see fewer people, have patients come in one at a time. Families wait outside. You can't bring someone else in the room with you. And then trying to have not multiple patients. The patients are never close to each other. And then after we see one patient, we have to totally clean that room. And even, here's Ashley, we're doing things differently here in the OR too. So tell us a little bit about how we've changed things here.
So to start the day, now we have the patient give us a call when they reach the parking lot. And that way the nurse will meet them downstairs and we check a temperature, make sure that they're not running any kind of like low-grade fever. We do discharge instructions curbside now with their driver. Let them know, how long their surgery is anticipated for, and let them know that we'll give them a call. When they get up to the surgical suite, now we're trying to keep this one patient in the same bay through the entire day. Where typically we would have a pre-op area, we'd get them ready here, take them to the OR, and then bring them to a post-op area. Now we're trying to keep them in the same bay to limit the overuse and the chance of contaminating the next patient. We have a couple of bays here, so we're trying to keep them separate. If we have more than one patient, there's one here and then there's one at the end of the hall. So that way there's enough distance between them so as not to reduce the risk of infection.
We have the ability here, if we had 4 patients throughout the day, we could have every patient in a separate place, so no patients in the same place that there was previously a patient that same day. And then we clean everything at the end of the day like we would normally do, let's say at the end of the week. In fact, as we come down here to the OR, and in fact the bathroom we have to clean, in between each patient, just sterilizing everything. In the OR, normally there's a certain cleaning that we do between cases. Now we have to do the more extensive cleaning like you do at the end of a whole day or week in between each patient. So that's okay, it slows things down, but it's slowed down out here too, like in the office, having one patient in at a time. The good news is everybody's back on the schedule, booking people out, seeing consults now, mostly virtually, right? But we're doing our pre-ops and post-ops in the office. So things are a little different, but we're getting back up to speed.